Hi, everyone. Dr. Andy Barlow here, graduate of the Carrick Institute of Functional Neurology, as well as a graduate of the American College of Functional Neurology. I practice in Tupelo, Mississippi. I'm in the trenches every day, just like you guys. And the difference between me and most of the consultants that are out there, they are not in the trenches. They can adapt to the new environment or whatever. And I don't tell my people that's in my Barlow Brain and Body Institute program, hey, here's what you should do. All I do is tell them, here's what I'm doing. And, here's how I'm changing people's lives. This is how I'm making a phenomenal living. And I want to offer you that same opportunity as well. And if you've never met me, the best place to go to here is Barlow Brain and Body Institute. And I actually have a frozen shoulder seminar coming up November the 11th and 12th in Conroe, Texas. I can't possibly make it any easier for anybody because I used to give these seminars in Tupelo, Mississippi, but now ErgoFlex technology, where they make the back on track, knee on track, and brain and body O2, they have allowed me to come in and give this seminar at their location. And most places can fly right into Houston International, Bush International Airport, and it's merely a 40-minute drive, and we're there. So tonight, what we want to do is we want to talk about frozen shoulder and how we actually help people with this, and some things that we need to know with frozen shoulder. Now, I'm going to give you an example too. Just it could be frozen shoulder, it could be thyroid. I'm going to use one lady that came in today, and please forgive me, I'm trying to get this board up right here. Came in to call me up yesterday, and we got her in, and she called in for thyroid. She said, I've had Hashimoto's for at least 6 years, and every time I talk to somebody about thyroid, your name comes up. And this lady lives 50 miles from here, so it's not like it's just right around the corner. And that's what I train doctors to do, is to promote themselves so that when someone has a chronic health problem, you're the guy or you're the gal that they're actually looking for to get help. And so this lady comes in, and she knows she has Hashimoto's. Nobody's been able to help her, hence my book, License to Heal: What to Do When Traditional Medicine Has Failed. And she comes in, and I ask her on the phone, and I'm usually not answering the phone, but I had a staff out yesterday and today because Sandy is sick. And then anyway, the phone gets backed up, and I just happened to be up front and I answered it. So, and then I asked her, I said, do you have focus and attention and concentration issues? And she goes, yes, I do. And this lady's 49 years old. So I said, well, one of the things we're going to have to do is a brain map. We're going to have to look at your brain, because you've got focus, attention, and concentration. You've got a thyroid problem. And I know this is frozen shoulder, not about thyroid, but I'm using this as an example to stop looking at the blinky light. And she has an autoimmune thyroid. She probably has an autoimmune cerebellum. And then she's in that segue between stage 2, stage 3, Alzheimer's, according to the Alzheimer's Association scale of the 7 stages of Alzheimer's. Now, so my point is, patients are going to come into your clinic with pain. Just like this weekend, I gave a seminar, doctors all over the United States, on movement disorders. And when it comes to Parkinsonism, 85% of people with Parkinsonism has pain, chronic pain, and doctors don't know what to do with these people. And so these people, if you're doing peripheral neuropathy workshops or knee pain workshops or a frozen shoulder workshop, virtually none of these people are just going to have frozen shoulder. And it's going to be your job to find out, do they have focus, attention, and concentration, early onset Alzheimer's, movement disorders, or Parkinsonism type of issues. Now, this is what's important. Now, directly linked to frozen shoulder, the first movement disorder when a person has in regards to Parkinsonism is actually gut motility. Their gut slows down. And the next thing that happens is they can have olfactory loss of sensation, but also stiffness in the shoulders and hips, which can lead to also frozen shoulder. So again, that's how I segue and come all the way around the barn here when it comes to frozen shoulder. And what does this have to do with brain degeneration? It has everything to do with it. So let me reiterate that people who suffer from Parkinsonism, the first movement disorder is actually in the gut. And then from the gut, we can actually have toxins, environmental toxins that destroy our olfactory gland, which the gut and the olfactory gland can be damaged due to aggregation of what is called alpha-synuclein. And on top of that, the stiffness that comes in is because of the mesencephaline. We're not able to fire dopamine from the mesencephaline into the brain, and also the red nucleus, which controls our proximal muscle in our shoulders and in our hips. And we start to get this stiff joint. We start to flex forward. And then a patient may come into you complaining of, okay, because you're marketing frozen shoulder, and they may say, well, I don't really have a frozen shoulder, but I've got a stiff shoulder. Or you may have people that come in, and if you go come to my seminar, and a person can actually bring their arms to 90 degrees, you should be able to solve that problem. Now, in my clinic, the way I set this up is the patient pays me up front $4,950, and then if I don't get full range of motion in 2 visits, I give them a full refund. And the good news about this is 80 to 90% of people you're going to be able to help. And if they can get it to 90 degrees, you should be able to correct almost every one of these people. So what better way of being able to charge people for care, seeing them for 2 visits, giving them home therapy after that if they only have frozen shoulder, and you charge $4,950. And it's just one of those where if I don't get results, you get a full refund. I've only had to give 4 refunds back in 1 year, and it doesn't matter. I'd like to keep the money, but the deal is if I don't get results in 2 visits, you get a full refund. So when you come to this seminar, it's $2,500 plus your traveling expenses. But how many seminars would you be able to go to that you actually paid for the seminar, traveling expenses, hung out with great people, very successful people, and you're able to leave that seminar and on Monday morning be able to fix somebody with a frozen shoulder and charge $4,950. And I think that's a pretty incredible program that we have. So also you can see on here as a bonus with this, we also are going to be dealing with neck issues. And we're going to be talking about the 3 entrapment syndromes that we have in the brachial plexus. So when it comes to numbness in the hands, we also have to know how to deal with this. So the selling point for the seminar is how to fix a frozen shoulder in 2 visits. But also when it comes to entrapment syndromes in the neck, we have 3 areas that are entrapped. And then when we're dealing with the arm, we have the median nerve, ulnar nerve, and radial nerve, and each one of these nerves can actually be entrapped down the arm. So you need to know how to, 1, fix a frozen shoulder, get results in 2 visits, or you give the person a full refund, and $4,950, that's the deal. That's what I charge. You can charge whatever you want to, but I promise you, when a person's had a frozen shoulder for 4, 5, or 6 years, they've already paid more than $4,950 out of pocket with 0 freaking results. And so you can, come in here and get these results with frozen shoulder. As an added bonus, we're going to be showing you how to actually activate the muscle spindles and Golgi tendon organs in the neck, the entrapment syndromes in the brachial plexus, and then the entrapment syndromes for each one of the peripheral nerves. And remember, 3 areas in the brachial plexus, and each one of the peripheral nerves have 3 actual entrapment sites. So one of the things that we need to do is when it comes to these with the shoulder, the first thing that we have to realize is that C5, okay, C5 controls all of the muscles in the shoulder except for 3 muscles. All right, so just knowing that concept right there, that you have what is called the pec major, we have the latissimus dorsi, and the long head of the tricep. So all the muscles come out of that control your shoulder are from 3 muscles except C7. Okay, and I just named those muscles pec major, latissimus dorsi, and the long head of the tricep. Now, what we need to know, why that's a reason to know, is because one of the most susceptible areas for any type of head trauma or whiplash injury is going to be C5. So anytime a person comes into my clinic with shoulder problems, C5 also goes back to the rhomboids. So we have to stop looking at the blinky light and go, okay, this person has shoulder problems, a frozen shoulder, and then she's also had a car wreck 20 years ago, and that correlates with the C5 degeneration in stage 2. We know that all the muscles that come out of the neck, or the nerves that come out of the neck and go to the shoulder, are controlled by C5, except for 3 muscles, which are C7. And then we start to correlate this with, do you also have problems back here in the rhomboids? Because C5 comes directly off the nerve root through the dorsal scapular nerve and controls the function of the rhomboids. So a person may have a forward head carriage. They may start to get this hump back here in their back because of the forward head carriage. And then we get, at the end of the day, they feel like the weight of the world is on their shoulders. So when a patient comes in, the thing that we want to do is we want to ask them about C5. We know that the muscles from C5, all the muscles in this shoulder are controlled by C5 except for 3 muscles, and those are C7. Now, also, the way we do it in our clinic is when a patient comes in with any upper extremity issue, I don't care whether it's numbness in this hand, numbness in this hand, or both hands, shoulder problems. They say, I just have a shoulder problem here. This is the shoulder pain, or this is the frozen shoulder. What we're going to do is we're actually going to do a bilateral x-ray. Now, we don't take insurance, so we can do whatever we want to do because we're here to serve the patient, not rape the insurance company. All right. So that's, that's just the game that we play. So I can take x-rays of both shoulders, and lo and behold, you've got a person with a shoulder problem on this side, but this shoulder here is as degenerated as the painful side, and this one is causing no pain at all. And so we have to understand that from C5, we can actually have radicular pain in this area. Maybe this shoulder is producing more inflammatory processes than this one for whatever reason. But the point is, we want to look at this from a bilateral standpoint. We have to stop looking at things as though it's monomodal. All right, so we got a shoulder problem. We want to take an x-ray of this shoulder to rule this one in or out. Do we have some damage? And then we want to look at the cervical spine. So we want to correlate all of those together. And on top of that, just make it a habit that if a patient comes in with any shoulder problem or upper extremity issues, just always ask them, tell me about your first car wreck. And then tell them to describe the first car wreck. What happened? Okay. And then, because what is going to be interesting about this is I've had husband and wives that come in, and the husband is the driver, let's just say, and then he's got neck pain and a left shoulder problem. The wife, the passenger, and she's got neck pain and right shoulder problems. And they were in the same car wreck. So how can this? And again, they don't even correlate the two. That, hey, they were in a car wreck 10 years ago, and so if you have if you're the driver, which way does the car seat come across? It comes across to your left shoulder. If you're the passenger, which way does the car seat come across? From your right shoulder. So both these people were in a whiplash injury, and both have neck problems and shoulder problems, but one's on one side and one's on the other. And then you come in and go, okay, tell me about your first car wreck. Were you the driver? Were you the passenger? Where's the seatbelt? And then you because you're actually a critical freaking thinker, then you look like a damn genius because of just asking some simple questions. All right. Had a lady come in about 3 weeks ago. Nobody can solve her damn neck problem and shoulder problem. All right. She's been to chiropractors, this and that. And so, of course, we're doing metabolic care. And I'll get back to this side impact here in just a minute. But the reason that we do metabolic care when these people come in, and it's not trying to upsell things, my job is to get a person as close to one as possible. If you've had a whiplash injury within 6 to 12 hours, you're going to start the cascade of a leaky gut syndrome. So I don't just ask them about, oh, you got shoulder problems linked to the neck. Tell me about your first car wreck and leave that alone. I want to know about the first car wreck, the second car wreck, the third car wreck. I want to keep going till they run out of car wrecks because every one of them is cumulative. And then from that first car wreck that you had 20 years ago, within 6 to 12 hours, you set up the domino effect of a leaky gut. So, and then within about 7 days, most people are going to have the full onslaught of a leaky gut, of dysbiosis, and that whole slowing down of gut function, which then is going to release inflammatory processes into the bloodstream. And then we circle back around and go, tell me about your focus, attention, and concentration. Okay. And then now you're in stage 2 to 3 Alzheimer's. So you came in with shoulder problems. We linked that to a car wreck, linked that to a leaky gut, linked that to stage 2 Alzheimer's because you're having focus, attention, and concentration issues. And see, that's how we wrap this whole thing up in our clinic. But if a person just wants me to work on their shoulder, I'll do that. But very seldom when you open that door that they just want you to work on the shoulder. They want you to solve whatever it is that you find. So let's talk about another case. Lady's driving down the road. I forget exactly how many years ago, 20, 25 years, something like that in that neighborhood. So what happens is she's driving down the road and then bam, gets a side impact oblique from the front left side. Okay. And then what happens is she goes into this whiplash injury over here on this side. And then you hear this thing, oh, well, nothing really happened, had a car wreck. Everybody said everything was normal. And see, when somebody says something like that, the first thing I ask them is, tell me what happened to the car. Oh, the car was totaled. Oh, yeah. And I'm like, okay, well, if the car was totaled, you were totaled as well. It just took probably 15, 20 years before everything starts to manifest itself. But make no mistake, if the car was totaled, that person was totaled. Because I tell the patient, I go, okay, let me get this straight. The car is made out of steel, plastic, and rubber, okay? And it was totaled. And what are you made out of? All right. You're made out of, what you're made out of is blood vessels, bone, neurological tissue, and fat. No fat jokes in Mississippi. But see, the point is, if you damage metal, steel, and rubber, you're going to, the weakest link in the chain here is the human body. And then you're strapped in, okay, and you got this neck here, and you got this 10-pound bobblehead flopping all over the place because your entire body is strapped down to a seat, okay? And what was amazing about this is because nobody correlated this. What happened is she came in and she had neck pain and shoulder problems for ever how long, couple of years, whatever. But see, nobody asked her about a car wreck that she had 2.5 decades ago. And so we've got this compression on this left side. We've got this entire collapsing of this left side because of the momentum from this car. Shoulder hits the windshield, okay? And then, again, it has to do with critical thinking here. And so we're just, I don't know, I think doctors a lot of times just don't listen to their patients. They're just in here and it's like, I wish they'd hurry up and shut their freaking mouth so I can go in there and start banging bones or whatever. Let me do the flying 7 on them. And I'm actually trying to figure out why these people have this problem. Why has everyone else overlooked this issue? And again, I think that, and I'm just telling you this from my personal opinion, I think that if you're taking insurance, you're just trying to rush a person through so you can get in there and bill their insurance. But I'm not an insurance biller. I'm in the business of changing people's lives. And so and by doing that, I actually have to pay attention to what the patient says. I critically think, and let's see what we got here. Leaky gut, leaky brain research. Yeah, leaky gut, leaky brain. And so again, what happens is with that is you've got these glial cells, and the glial cells are supposed to actually heal your brain. It's a support mechanism, but when we get brain injury, and there's brain injury from trauma, there's brain injury from autoimmune disorders, blood sugar, inflammation, cellular mimicry, a whole host of things. But then when the glial cells become overactive, the way I look at it and the way I explain it to people is your glial cells, it's kind of like Dr. Jekyll and Mr. Hyde. When it's Dr. Jekyll doing its job, he's in there, with a vacuum cleaner, cleaning up your room, dusting everything off, making everything look clean, and pruning things, if you will. But then when this thing becomes overactivated, instead of pruning and cleaning things like with a vacuum cleaner, then it's like I got a chainsaw in one hand and a machete in the other. And the destruction that's going to go on is in your brain. Then it becomes self-perpetuating. As the glial cells become active, causing inflammation, inflammation activates the glial cells. Then we get this brain fog, and then we start to have this, the vagus nerve is no longer able to communicate with the gut, and we've got this entire inflammatory cascade. So the point here is with this is, if you would, please, if anyone comes into your clinic with these upper extremity problems, especially shoulder, neck, rhomboid issues, just ask them from now on about, tell me about your first car wreck. And then we can actually move forward from there. And again, it's not about trying to upsell anything. It's about communicating with the patient. It's going, here's what I see. And one of the things I would like to ask you to start doing from now on is, when a patient comes into the clinic, I don't care what their symptomatology is. It could be focus and attention. I don't care. It could be movement disorders. It could be, I can hardly walk. But on a scale of 1 to 10, how bad would you say your problem is? 10 is it can't get any worse. And then here's the magic here, and that is, what number do I need to get this to for you to be happy with the results? And most people have been beat up so badly over the years and decades that if you can actually move the needle and get them to a 3 or a 4, they would be happy. And I go, if there were a way that I could get you to a 1, would you want to know about that? Now, I didn't tell them I'm going to get them to a 1. I just said, if there were a way that we could get this to a 1, would you want me to know about? Would you want to know about that? So that gives me, once a person says yes, then that gives me permission to do whatever needs to be done from a neurological standpoint, metabolic standpoint, taking radiographs, to go, we've got to move this as close to a 1 as we can possibly get it. And that's going to mean running metabolic testing. Possibly we do true dose PRP in our clinic. We have a medical doctor on staff that does that. And so again, it's, if they give me permission to get them as close to a 1 as possible, that's what we're going to do. So to wrap this up tonight, and we'll go a little bit each week, we'll go a little bit more in detail. We can draw out the brachial plexus. We can talk about a lot of different things with frozen shoulder. But I promise you, if you come to this seminar, this will be one of those, one step that's closer to moving the needle and actually changing the quality of your life, because it's another one of those niches that you're able to provide for. And I hear doctors saying all the time, well, what if I charge these big case fees and I don't help these people? Well, one is you didn't manage patient expectation, but I never leave my office, never. I don't want to use, absolutes very often, but I never leave the clinic going, man, I hope I can help that patient. If you've ever done that, then at some level, in my opinion, again, I think you've taken advantage of a patient at some level, or you haven't communicated effectively enough. Because in my clinic, if I can't help people, I'm not going to accept them for care. And then once a patient says, yes, I want you to get me as close to 1 as possible, then we're going to do a gamut of blood work to help them optimize the recovery and to get to the root of this actual problem, and literally leaving no stone left unturned to get to this root cause. And then 2, stop looking just at the blinky light. And because what happens is, for lack of a better word, you're leaving money on the table and you're leaving the person's life on the table. Because if they have a chronic health problem like a chronic frozen shoulder, they have more than just chronic shoulder pain. And if you actually know how to observe these people and you start to see these forward head carriages, or stiffness, then we go, hey, this is the early sign of Parkinsonism. And then I had a doctor that I know that sent me an email today, and he said, well, I had a patient pay me over $34,000 for care. And what the patient actually ended up having was neurodegeneration. But see, the thing is, they don't come in complaining of that. They don't come in saying, I've got Parkinson's or I've got early onset dementia. They come in with knee pain and hip pain, frozen shoulders, shoulder pain, because this lack of mobility leads to neurodegeneration, and the person can no longer produce brain-derived neurotrophic factors, and they can't produce brain-derived neurotrophic factors so that the neurons can actually reconnect with itself. So see, again, when we're dealing with a frozen shoulder, it's not just a frozen shoulder. And I'm going to leave it at this because I've only got just a few minutes before this computer shuts off. So just let me say it this way. This right shoulder fires to the ipsilateral cerebellum. This cerebellum is there's 3 lobes to the cerebellum, and the part of the lobe of the cerebellum that controls the shoulder is called the paravermal region. In the paravermal region, you have what is called the globus and emboliform. All right, so that's one of 3 lobes in the cerebellum. And each one of these lobes are presynaptic to your autonomic response. So just knowing this, that every lobe of your cerebellum is presynaptic to the autonomic response, when you have a frozen shoulder and it's decreased in its function, then the cerebellum on the right can't fire to the reticular activating system on the right, and it also can't fire properly to the parasympathetic nervous system, which means we become dysautonomic, usually leaning more toward parasympathetics. This right shoulder is presynaptic to actually, in the pontine area, we have what is called the raphe nucleus, and the raphe nucleus actually produces serotonin. So what happened with that? We start to have anxiety, depression, and people they have a problem sleeping at night. So, and then this frozen shoulder is presynaptic to the right cerebellum, which is presynaptic to the right reticular activating system, which is presynaptic to the right parasympathetic nervous system. And then it decussates or crosses over to the left mesencephalon. Well, what does that activate? That activates on the left side. This actually activates what is called our mesolimbic mesocortical system. What does that mean in English? It means that it makes on the left side of your mesencephalon, it helps produce dopamine. And dopamine goes to your limbic system and your cortical system. So you also may have a problem with dopamine. Now, the problem with this is when people have decreased serotonin function and dopaminergic function, then these are the people that everything in life sucks. You know, their wife sucks, their job sucks, their kids suck, you know, TV sucks, car sucks, everything sucks. So see, again, you might have a person that comes in to your office with left shoulder pain, frozen shoulder, anxiety, depression, can't sleep at night, autonomic dysregulation, and you need to know that we have this connection between the shoulder joint, cerebellum. Cerebellum is presynaptic to the reticular activating system, is presynaptic to the autonomic system, is presynaptic to the contralateral mesencephalon, and which produces in the mesencephalon, the substantia nigra pars compacta. This produces dopamine, and it sends dopamine to the limbic system and frontal lobe and basal ganglia. And then this actually keeps our contralateral frontal lobe and parietal lobe alive. So see, again, it's not just, hey, you have a frozen shoulder, but the problem is if I can't pick my arm up past this point, I think it's within its half-life of protein is like 6 to 10 days. So within about 2 weeks, these systems start to atrophy. And then whenever the muscles atrophy, everything post-synaptic to that I just named is also going to decrease in its function and become hypotonic and become atrophic as well. So again, it's not just a frozen shoulder, it's the entire neurological system that's linked to that shoulder. And by the way, the shoulder, if you look at the homuncular map, the right shoulder is here on the lateral side of the brain right here. And then we understand that the middle cerebral artery controls this function. So when we lose activation of this shoulder from here to here, we also lose the middle cerebral artery can't shunt blood flow into this area of our brain, and then it starts to atrophy as well. You don't use it, you lose it. So I want to thank y'all for being here tonight. And if you have any questions, you can go to barlowbrainandbody.com. You can send an email, or the phone number is there that we can help answer any questions. I do highly recommend that you attend my upcoming seminar that's in Conroe, Texas. You can register on barlowbrainandbody.com, and I look forward to seeing you guys next week. And by the way, if you do have anything you would like for me to go over when it comes to the upper extremity issues, neck, shoulder, hands, elbow, just please send me an email so I can actually cover that at the next seminar. So thank you very much, and we'll see you next week.